Hello and welcome to the Caregiver's Guide to Alzheimer's here on ZubiaLive. My name is Winslow Dixon. I'm a holistic health practitioner, a published author, and geriatric specialist in Alzheimer's and dementia for the last 10 years. And today we're going to be discussing how to care for your loved one at home. I know that with the daunting diagnosis of Alzheimer's disease, there's the conversation of how can you best care for your loved one. And especially in the later stages, it can be difficult to keep your loved one at home. So I'm going to give you some tips that I have discovered from being in the industry for as long as I have. Basically, when it comes to care in Alzheimer's and dementia, the first priority is safety. And we all know a new baby or newborn or a new puppy or something like that, you want to safeguard your house. You want to baby proof the house. Well, the same concept can be applied to Alzheimer's. You want to really Alzheimer's-fy, if that's even a term, your home. You want to make it as safe for your loved one as possible. Safety is the number one priority when it comes to caring for your loved one at home. And there are things that you typically don't think about protecting an adult from. But in the later stages of Alzheimer's, we've discussed in this series how people can become disoriented and not be able to understand the reality that's going on. So things like lighters, candles, stovetops, things like that, even car keys laying around can become a hazard. So you want to make sure that when you're preparing your home to take care of someone in late stage Alzheimer's, or even moderate Alzheimer's, that you have these things protected, that you have safeguards that keep locks on things that you wouldn't want someone that was in, a manic rage or, a disoriented mental status to get a hold of. You want to make sure that your home is safeguarded. You want to make sure that those car keys are up. You want to make sure that those lighters are not available. You want to make sure that your home is basically a safe zone. Like I said, Alzheimer's proofing is kind of the term that this is given, is you want to make sure that your home is as safe as possible. Also, you want to make sure that you're reducing the elopement risk. And elopement basically means that someone that has Alzheimer's disease can kind of wander off. Walking and wandering is a common symptom of Alzheimer's disease. And so when you have someone in your care at your home, you want to make sure that there are safeguards in place so that they don't get disoriented and walk down the street or try to, go somewhere else without your knowledge. Elderly elopement is very common and it can be prevented with simple safeguards such as, having someone there 24/7, the later stages. That being said, if you are the primary caregiver and you need a break, there are services such as home health aides, CNAs, home health care agencies that can come to your home and help you with those things. There are also devices such as the Life Alert and things like that that have GPS trackers and signals. Those things can be definitely beneficial in preventing the elopement. You basically want to make sure that they're not left alone, and if they are in a disoriented state, that you can kind of stay with them or have a caregiver, or an agency staff member that can help them in those moments, because you don't want anybody wandering off in late stage Alzheimer's. And, we just want to keep them as safe as possible. So we want to make sure that the elopement risk is not there. We want to eliminate that by having someone there with them, especially in the later stages. That being said, we need to discuss sundowning. We've talked about that in the previous parts of this series, but sundowning is basically in the later hours of the evening. Alzheimer's patients tend to get worse. The disorientation and the mental disparagement can get worse in the evening. And so it is important that you maybe pay attention extra during these times. Maybe this is the time where you sit down with them and have a meal, and still engage them in things so that they're not constantly fearful or getting disoriented and things like that. And if they do get disoriented, it's not so much important to try to reorient them, because sometimes that's not possible, especially in the later stages, but try to be with them and comfort them in those moments. So if they are in a fearful place in their mind, that you can try to comfort them. That being said, there are also medicinal means to try to help manage those symptoms. We talked about in the last series about some of the medications that are used. Benzodiazepines and medications like that are prescribed to handle the anxiety and the disorientation that comes along with sundowning and some of the Alzheimer's symptoms. So utilize those types of things. If the sundowning is getting worse and you're having trouble keeping your Alzheimer's patient or loved one, oriented, talk to their physician about getting them some help. Whether it's, medicinal means or some alternative things. I know we mentioned some people use lavender essential oils and things like that. Find something that will help them. And if they are getting to a point to where they are more than you can handle, there is absolutely no shame in having someone that's licensed and trained from an agency coming in and helping you. I don't want anyone to have any guilt that an Alzheimer's patient is too much for them to handle, because unfortunately, this is a very daunting disease. And some people can have severe aggression. Some people can become violent. This disease is very random in how it affects different people in different ways. So if you are struggling with that, first of all, talk to the physician and see if there's a medicinal means or any alternative therapies that can benefit. And then if that does not work, there is no shame in getting someone licensed that can come in and help you when you have those moments of them being so disoriented you can't keep them from elopement and things like that. You're going to want to provide them with what they need and also provide you with what you need. As a caregiver, it's a difficult thing to watch. As a caregiver, you also need to take care of yourself. It's like that, that old saying, you can't pour from an empty cup. That's very true. If you're completely depleted, if you're, awake 24/7, making sure that they're not, wandering outside or something like that, you're going to need that break, and you're not going to be 100% sharp to take care of them or yourself. So reach out to support groups. Talk to the physicians, get a team together to help you manage this disease, help you care for your loved one. There's absolutely no shame in that. That being said, some tips for caring for your late stage Alzheimer's residents. Working in this industry, I have learned that especially in the later stages when communication is not there anymore, you have to really watch out for the nonverbal communications, because they might be at a point where you can't understand them or you can't know what's going on. And so you have to watch for signs such as, if they're shivering, if their face is flushed. They can't tell you if they're hot or cold. You have to kind of watch that. If they're in pain, they can't tell you that. So you have to watch their facial expressions, their reactions to things. Are they grimacing? Are they holding a part of themselves? Those are those nonverbal things that you really have to watch out for. And they might not be able to tell you that, but you can tell from their nonverbal cues if something's going on. So really be vigilant of those things. You can kind of tell if there's something going on by if they're grimacing or something like that, or, their body temperature or something like that. Really be vigilant of those nonverbal cues. Also utilize, mobility aids, utilize tools to help you manage with your Alzheimer's patient. There are many things, such as mobility aids, if they're struggling to walk, if you're worried about them falling, walkers, canes, gait belts, things like that are there to help you. If eating is becoming a struggle and things like that, there are adaptive silverware, things like that. There are adaptive toiletry devices, things like that. Really talk with your geriatric specialist and your healthcare team on things that can improve their life. Really. And it's not just medications, it's mobility aids, it's, things that can be used to give them the best quality of life. Utilize all the options that you can. This is why finding a good physician early on is very important, because if you establish a good relationship early on with your healthcare provider, years down the road. If you need something, they're going to be like, okay, yeah, if she's having trouble breathing, then I can write for a nebulizer or something like that. You'll have that communication to where you can call someone and get things fixed, and you can have a good healthcare team. Whereas if you wait till, communication is broken down, and then you come in and, you don't have that relationship built up over those years. So I definitely recommend getting a good healthcare team, from the onset of diagnosis, and writing down things and having conversations early on. That way, if the disease does progress and you do have the communication breakdown, you have what they wanted. You have what they would have wanted. And you've already had those conversations. And as a caregiver, you can have that peace in your heart saying, okay, this is what mom, grandma, grandpa would have wanted. So have those conversations early on. And I can't stress enough that as a caregiver, you have to take care of yourself as well. This is a very difficult, daunting disease to manage, especially if you're, the 24/7 caregiver at home. So definitely be reaching out to your own physicians, reach out to support groups, get help with this thing. Really, this is a daunting disease, and it's really not meant to be walked through alone. So reach out to those things, and as far as treatment options, have those conversations, discuss medications, discuss alternative treatments, open every door to try to bring the best quality of life. Because our objective with Alzheimer's and dementia is to try to give our residents and our loved ones the best quality of life possible despite this diagnosis. So we still want them to have enjoyable moments. We still want to enjoy them. We still want them to smile and be happy and have those moments for for the remainder of their lives. I mean, that's what we want for any of us. So when you are a caregiver, I just want to stress that getting a good healthcare team is imperative. There's no shame in getting, a home health agency if you do need help, and make sure that your home is safeguarded. So just utilize all the options. And I can't stress it enough that Alzheimer's is a daunting diagnosis, but that doesn't mean that they still can't have enjoyable moments. And that's what we're just trying to provide, is enjoyable moments despite the diagnosis. So this has been the Caregiver's Guide to Alzheimer's on ZubiaLive. My name is Winslow Dixon, and I thank you for tuning in.